give an update on the COVID-19 status of our county. After that, we will open it up to take a few questions from the media concerning the COVID-19 incident, limited to 2 questions from each media outlet in order to preserve the schedules of all of our staff. If time allows, we will also take questions from the public. If you are a member of the public, please leave your question in a comment on the video on this video below in the comment section, and we will do our best to address it. Now, beginning with the COVID-19 health update, Dr. Coren, you have our attention.
Hello, everybody. So first I'll start with the data. And United States coronavirus total cases this morning is 27,896,040 cases. The deaths are now 493 and 98 citizens. In California, we've reached 3,505,032 cases and 47,902 deaths. In Mendocino County, as of today, the average daily new cases is down to 17.71. The positivity rate for tests is 7.71%. And this is up, we believe, because of low testing. Our cases are slowly but steadily decreasing, and that's confirmed by a statistic, an REF value of 0.71. When it's 1, it means that 1 case of COVID can be passed to one other person. On average, this is an average number, but less than 1, one person will only be transferring it to less than 1 person. So the total cases at this point in Mendocino County are 3,750. That's an increase of 10% over the last 2 weeks. Of those numbers, the Latino cases are 1,891, which is 51%. In isolation currently are 153 people, quarantined 141, and the deaths now number 42 of our citizens. There was recently 1 Hispanic, 1 Native American, and 1 Caucasian who passed away. In the hospital are 7 med-surg patients, 3 in the ICU. 1 of these is from Tulare County, another from Washington State. And there are 3 Mendocino residents who are hospitalized and 3 in skilled nursing facilities out of county. Currently, outbreaks have changed quite a bit. The 7 restaurants on the coast and Round Valley have both resolved. The county jail is considered resolved at this point, though there are 2 cases. Those are people who are not epi-linked and they've just been admitted to the jail. The new outbreak is in Mountain View Assisted Living, where 23 residents and 7 staff are involved. The first case was reported on February 11th, but that was a full week after the testing was done because it has to be sent by that organization to Texas, and it's a very slow reporting process. Of these people, 2 individuals are hospitalized and 1 passed away earlier this week. Testing is now available at the Ukiah Fairgrounds Sunday through Thursday at 9 to 5 p.m. and at Fort Bragg Vets Hall on Tuesdays. We're hoping to start the mobile team on Fridays, rotating between the other 6 towns within the next 2 weeks. Consolidated Tribal and some clinics also do have testing events as well. Currently, we are in the purple tier. It is noteworthy that since we last met, religious institutions may have services indoors at up to 25% capacity. K-6 schools are now beginning to open. Some stayed open, and Ukiah Unified School District opened on February 16th for kindergarten to 3rd, just to start, but they'll probably be opening more as time goes on. Fort Bragg Unified School District plans to open this coming week. Other schools are sending in their safe school opening plans. Middle and high schools must wait until our county is in the red tier or less than 7 cases per day. And then they are preparing those plans at this point. In the meantime, the upper schools are on continuing distant learning. Vaccines. Accounting for vaccines is ongoing statewide due to the many changing and poorly interacting platforms in the state, as well as because of some human error. Mendocino County has been painstakingly reconciling all the variations, working with our state team, Accenture, and our partners to rectify any IT issues. Overall, this project is proceeding well in preparation for a third-party administrator, which will be Blue Shield, to assume responsibility for allotments and dispensing. This requires completing the reconciliation process using MyCAVax and Vaccine Finder for ordering and accounting, and CARES and MyTurn for scheduling and reporting each vaccine with age, race, ethnicity, data, all input. And we also use VAERS for reporting any adverse reactions. We have been using Vaccinate Mendo and Schedule Genius for scheduling. Our pilot of MyTurn, the new state scheduling program, was very successful in this past week. So next week we'll start using this as it will be easy for people to access in both English and Spanish, online or by telephone. There's still some fine tuning that we need to work out, and we're working that out with the state team at this point. Distribution of vaccine supply is still a major challenge for us and all of our surrounding counties. However, we expect to have a gradual increase over the next month as there is now a new formula being used by the state. And also we're hoping that in March, the one-shot Johnson & Johnson vaccine will be approved and will be shipping, which will relieve a lot of pressure. Nevertheless, without knowing our allotments, it is difficult to plan first dose clinics. We are trying to start these, but at this point, the majority of our clinics or events are second dose. And part of the problem this week for next week is also that there are delays in the shipping because of the weather event in Texas. The good news for Mendocino, as of February 18th, the state shows we had distributed over 21,000 doses to 14,479 individuals. This represents over 20% of our county has had at least one vaccine, leading most of the other California counties. We are working closely with our partners, 3 hospitals, 6 clinic partners in the city of Ukiah. At least one of our clinics has also been approved to get direct shipments from the state. We're waiting to see how that works out. At this point, we have been getting vaccines out within the week that we get it in. We estimate that through collaboration of our internal team and all of our partners, we can deliver up to 10,000 shots per week. We have vaccinated nearly all of the school staff, reducing one more barrier to schools opening, which is a priority. So who is eligible now? Please keep in mind that the state may be changing their requirements, but our tiers at this point show that we're finishing off phase 1A, the people who missed that. There are a few school staff, EMS providers, essential workers, home health, and home support, or some who've declined the first offer and may come back to get their vaccines. But the main phase that we are concentrating on is phase 1B, tier 1, which is anyone over 75 years old. That involves 6,800 people in Mendocino, people from education and childcare work, which is about 2,000 people, and agriculture and food service. We have not yet begun those between 65 and 75 because they represent 13,000 people and would be a very big drag on our supply up to now. However, we are finding fewer who want vaccines at the age group over 75, so that beginning next week, we'll be opening stepwise to those over 65. And then by March 15th, the plan is to open to younger people who have various comorbidities and disabilities that were outlined by the state. All of our partners are working together to get these vaccines to our community. The hospitals and clinics are focusing on the elderly population because of safety issues. The clinics are also calling those up who become eligible due to work and having them come in. And the county health department is doing the same. Deputy Health Officer Theron Chan has spoken with private medical providers who are not vaccinating to be sure that their patients will be called up for vaccine. So if you are over 65 and not seeing a rural clinic or an FQHC or a hospital clinic for your primary care, in other words, a patient of an independent provider, for example, my old friend, Dr. Rushton, if your provider has not called you, then you call them to be sure that they have your permission to send your name to a vaccine event organizer to schedule your vaccination. As I said, the county health department and city of Ukiah are focusing efforts on those who are at risk because of their employment, for example, teachers and agricultural workers, with our mass vaccine events. And we are contacting employers and our patients who fall into that category. If you qualify, bring a note from your employer. This will be confidential. Vaccine clinics next week include Tuesday and Wednesday second dose Pfizer offered by the county, and several of the clinics also have some second dose vaccine clinics being offered. Some new information is that for people who have had both vaccines, there is a change in quarantine requirements from 2 weeks after your second vaccine, when you're considered at full immunity from those vaccines. If you have in close contact with a case, there is no need to quarantine. This advice lasts for 3 months. As we learn more about how long these vaccines and the immunity lasts, this may be extended. This is also different for healthcare workers who want to work in hospitals or nursing facilities, and that will be for them to check with their facilities. To improve our regular messaging during this rapidly changing vaccine rollout, we have added new web pages showing vaccine accounting and to show where our events are. We're continuing the English KZYX and have added Spanish KZYX radio programming. We're translating our website into Spanish, and call center lines have increased staff, including bilingual staff. In summary, the holiday surge is winding down very nicely, and vaccines are here. The schools are beginning to open to in-person learning. We're aiming for an average case rate of less than 7 to go to the red tier, so middle schools and high schools and other businesses can begin to open. We in Mendocino County are getting the vaccines out safely and as quickly as possible. But a warning, don't get overconfident. We have a long way to go. To help us contain any infection before there are outbreaks, and in order to get to the red tier, please remember to test, 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 and stay vigilant. Continue to mask up, wash or sanitize often, keep your social distances, avoid gatherings, and again, keep testing, even after getting the vaccines. And that's all I'll say for today.
Thank you, Dr. Coren, so much for that update. Next, we are going to move on to our questions from the media. Up first, we have Sarah Reif. Sarah, whenever you are ready.
Can you hear me?
Yes, hi, Sarah.
Hi. So you mentioned that you've started collecting demographic data to be able to turn over the distribution to Blue Shield, and I'm wondering what the existing demographic data is saying about who's getting the vaccine in terms of age and race.
So the Blue Shield is going to take over evaluating and administrating the program, and they get their data directly from the state. Give me a second and I'll try and get our data. think I know where I have it. Okay, so this is for those people who have had one dose of vaccine, 18 to 49, the age 18 to 49, 30%, 50 to 64, 21.7%, 65 plus is 48%. Latino is 13.6%. Caucasian is 48.4%. Black 0.2%. American Indian, Alaska Native is 0.9%. Asian American is 1.2%. Multi-race is 16.4%. And other and unknown together are 19%.
And that data goes back just a few weeks, right? Not to the very beginning of the pandemic.
And then this is for vaccine data.
Oh,
And
for
as of February 18th. I thought that's what you were asking.
oh yeah, yeah. I was just wondering if the vaccine data had been being collected from the beginning of the vaccine rollout.
Oh, yes.
Okay.
Yeah.
Okay.
Yeah, the issues were that with the different platforms, there was a great deal of problem extracting the data from the CARES program. And some of the electronic medical records that were in the physicians or clinic offices do not download directly to CARES, but that wasn't clear initially. So there was a number of problems with platforms. That's what I was referring to before.
Right. And the next question, I'm wondering if there are more details on the rollout of My Turn and how that will affect Vaccinate Mendo, if people should re-sign up with My Turn or how that's going to be handled.
Yes, they will have to sign up with My Turn. Vaccinate Mendo has been very useful as sort of a holding wait list, and it's been manually pushed over to clinics who need certain groups of people. But My Turn offers some other advantages. First of all, the people who are having events, both the county and the clinics will register their events with My Turn and say when it is and how many spaces are available and who would be eligible for that clinic or event. On the other side, people will call or by internet sign into My Turn, and they'll put in their information, name and address and date and that sort of thing. And by virtue of that, the computer can match them up and say, oh, you're eligible, and here are some clinics that are available. And then you can begin a registration process and actually put yourself into an appointment. And at the time that the clinic is opening up their clinic, they'll see your name there. There'll still be some on-site registration that's necessary, but it will be much smoother to get in that way.
Thank you, Dr. Coren, and thank you, Sarah. Next up, we have Adrian Bowman. Adrian, whenever you're ready.
Hi, can you hear me?
Yes. Hi, Adrian.
Hi, Doctor. I'm wondering if you could elaborate a bit on the situation in the jail and what the final stats for that were. You gave some stats this Tuesday to the soups, but I wonder if there's been developments there and in terms of how many people got sick and any deaths, etc. Just to start.
Yes, I think I have that. Let me just get it up on my screen here. You know what? I don't have it on the top of my fingers, but let me see. Becky, are you able to help with those numbers? Oh, I do have it. Excuse me. I have it. So there were 147 people who were positive ultimately. 130 of those were inmates. 17 were employees, all recovered. There are 2 who are currently in isolation, and those are people who were just recently admitted to the jail. They have no connection epidemiologically to those who were in the epidemic, who are part of the outbreak. And so the outbreak is considered closed, but there are still people in the jail who were admitted since then who have positive. It doesn't amount to an outbreak until we have 3 individuals who are epidemiologically connected that we consider a new outbreak. Does that answer your question? You're muted, Adrian.
Apologies. Now I got a bunch of pop-ups. If you could just clarify what percentage, if you could translate those numbers into percentages. So 147 positive is what percentage of the total jail occupants?
The jail population changes from time to time, but I think, I can't. I don't know it offhand because it changed throughout this time, and now they're at a significantly lower population.
Okay. My second question is, I wanted to get a little clarification around the comorbidity shift that you said was coming next week. Is that correct? Or the week after?
It'll be on the 15th of March.
15th of March. When it's opened up to people, will that be people all the way down to 18 or younger who have comorbidities, or will that be people sort of between 65 and 55?
No, we'll open it to 16 and up.
16 and so a couple clarifications on those comorbidities. Can you list what kinds of comorbidities would qualify as simple obesity, qualify as a comorbidity?
It would be morbid obesity. It will be, I don't have it right in front of me. It will be chronic lung disease, COPD, that is oxygen dependent. Be certain cardiovascular diseases like cardiomyopathy, heart failure, coronary artery disease, not simple hypertension. The autoimmune, or it'll be immune affecting diseases, or people who have who are taking medications. For example, people who have cancer and they're taking immune suppressive medications. And there's several others, but that'll be published when we get to when we do that.
Thank you so much, Dr. Coren, and thank you, Adrian. And as a reminder, we will be posting those comorbidities and other details on our public health Facebook page and also our website, so look out for that. Next up, we have Danila Sands. Danila, whenever you're ready.
Hello. Thank you for having this meeting. I'm glad that you guys touched on the comorbidity vaccination. That was a question that had been coming up here. Another one that my readers have been asking quite often, and I know you touched on it briefly there in your update, Dr. Coren, but with Pfizer and Moderna, there's some guidance and recommendation about at what point do they not need to get tested if they've been directly exposed to someone with COVID, and that we have this understanding that there's this 95% that they've been, effective. So what is that time period? I know that you said there was 2 weeks, and then after that, they didn't need to get tested.
Yeah. So at this point, people have had 2 vaccines, because those are the only vaccines that we have out, require a series of 2. So people have completed their second vaccine, and they wait 2 weeks for the full immunological effect. Then if they come in close contact with someone who does have COVID, they do not have to quarantine, but that only lasts for 3 months, because again, the vaccines have not been around long enough for us to know how long the vaccine immunity lasts. Does that answer your question?
Yeah, so you were saying only last 3 months, because at that point, we don't know if it's an annual shot, like influenza.
That's right. We don't know. It's a brand new shot.
All right, thank you. My other question is, there's this big issue about testing, and the testing has decreased greatly. I don't know if you have numbers to provide. And then as a result, the positivity rate is increasing. And I know that some of that could be due to vaccines or other testing being offered at, say, a health, a skilled nursing facility or a school. You talked about the other testing out there. Is that why you're seeing the testing going down? Is it still important for us to get, into the red tier for so many testing to still happen?
Great question. Yes, it is. But let me clarify something. The testing is not affected by the vaccination. So once you're vaccinated, you can still get tested, and we hope you will. We believe that the problem with the test positivity rate going up is because there are fewer and fewer people getting the tests. And I don't have that data right off the top of my head. But if there are less people getting the tests, then the numbers of people who are positive and getting tested are staying the same. And so the numerator will stay the same, but the denominator, the total numbers of people tested, will go down, and that means the total number will go up. The other value that I quoted was the R effective value. It does show that we are going down, and for good reason. It does look epidemiologically like the numbers are coming down. However, the best method that we have to contain infection is this testing. People are going to have infections and they don't know that they're sick. They don't know they're carrying the infection. And by having a positive test, we can limit the spread. And that's the only way we know to limit the spread, until a person is sick and is positive. So it's very, very important to continue getting tested.
Thank you so much, Danila. Next up, we have Matt Lefevre. Matt, whenever you're ready.
Can you guys hear me?
Yes.
Hey, thank you for hosting, all of you. Appreciate it. First question I have, is public health sending COVID-19 samples locally for genomic sequencing, and have any variants been identified?
Good question. We haven't ourselves sent any, but the state is picking up a certain percentage of the Valencia lab tests and doing some on their own. As I understand it, there are tens of thousands backed up. Their intention was to do 1 to, I don't know how many percent of all the tests in California. Here in Mendocino County, we've had 1 or 2 cases that have piqued my interest about that, as well as some surrounding counties have shown some variants. And so I've talked with CDPH about sending off those particular cases for genome testing. If they weren't done at the Valencia lab, and we don't have paired testing, and it doesn't fall into certain categories, there's a problem with requesting whole genome sequencing. We are now in another county lab, and that lab is developing the ability to do whole genome sequencing, and we're considering doing a percentage of our population for the genome sequencing, but it hasn't started yet.
Thank you, Doc. Piqued your interest, 2 cases? Can you? That's your phrasing is interesting to me. Can you speak to that?
Well, we talked about the Mountain View group, and the majority of those cases had been vaccinated a couple of weeks before, but it was only 1 vaccine. So they were definitely in a category that is susceptible to infection, but because the infection spread so easily and so well, I'm concerned that there could be a variant that would be more transmissible or less susceptible to the vaccination. But so to that extent, it piqued my interest.
Thank you so much, Matt. Next up, we have Jackie Orozco. Jackie, whenever you are ready.
Hi, Jackie.
Hi, thank you so much, Ashley. And doctor, la gente que no tuvo su segunda vacuna por alguna razón, después de un tiempo, y después de un tiempo que ha pasado, ¿cómo podría obtener su vacuna? People who did not get the second vaccine for whatever reason, how can they after time has passed for their vaccine, get it scheduled?
Okay, we will accept them and be able to vaccinate them. There's no outer limit. Their best protection, as far as we know from the research that was done before it passed the FDA, the best recommendation was getting the vaccine on time. So for Pfizer, that was 3 weeks, and for Moderna, it was 4 weeks. But that was give or take 2 days. Now we know that they can go for a significant period of time longer and still get their second vaccine. And if they call up one of our vaccine events or their clinic, that can be arranged.
Gracias. Y la segunda pregunta es, ¿por qué alguna gente tiene reacciones más fuertes después de recibir la segunda dosis de la vacuna? Why do some people have stronger reactions after receiving the second dose than the first dose?
Okay, good question. So when we give a vaccine, we are giving it in order to develop a reaction, an immune reaction, that the body will then recognize these antigens, these foreign substances, and attack them. So with each vaccine, we like to see some kind of a reaction. It tells us it's working. It's not it could be a very mild reaction and you don't even feel it, or it could be a severe reaction. After the first vaccine, and then getting the second vaccine, there's some immunity already built up. And so the body is more prepared to send out a bigger army to get those foreign substances we call antigens. And so that's probably the reason for a little bit more strong local reaction. Remember that all the vaccine reactions are pretty random. And some people will get more and some people get less. Some people have, a strong reaction on the first vaccine and none on the second. But if you were to ask, but the answer to your question, as best as I can give, is they already have some immunity, and so they're having a bigger reaction.
Thank you so much, Jackie. We appreciate it. Next up, we have Susan Wolbarst. Susan, whenever you're ready. You may have to unmute.
Sorry, little computer problem there. Okay, I wanted to go back to this Mountain View outbreak. You said that many of the cases there were people that had only received 1 dose. And I wanted to know, were the first cases reported, was it staff or people living there?
No, I think that the first dose, the first positive, I'm having trouble remembering it. I think it was a staff person that their test went off to the lab that Mountain View uses and took over a week to get the result back. And then the first group of residents was tested because they do routine testing at these facilities, and a large number came back positive at the same time, pretty close at the same time as the staff member had. So presumably the staff member was working with all of the residents while, I can't remember whether it was he or she was affected.
Thank you. And were those people vaccinated through the CVS Walgreens program, or how did they all get vaccinated?
Yes, it was through that program.
So the federal program.
Correct.
Okay, thank you.
Sure.
Thank you so much, Susan. We do seem to have a little bit of extra time today. So I will open it up once again to the reporters who have joined us on this meeting. If you have one additional question, one more question for either Dr. Coren or for DOC Manager Becky Emery, please raise your virtual hand. You can go to the side of your screen and select more. You can clap or do the thumbs up. Just alert me virtually that you have one more question that you would like to ask, and we would be happy to do that for you. Okay. Oh, okay. Adrian, go ahead whenever you are ready.
Before I do, I'm getting really strong feedback, kind of a howling feedback. I'm not sure if somebody has their audio on, or if that might be my computer. Oh, okay. It's gone. Sorry. It was actually maybe it was my computer. It was getting hard to hear. I just wanted to finish up the question on the next phase of comorbidities. If Dr. Coren, if you could tell us what technical level that is, 1B, phase 3, or whatever, and if that's and how you're going to balance that with occupational vaccination.
So the advice from the state is to focus the 70% of the vaccines on those who are elderly and 30% on those who qualify by virtue of their occupational exposure. Now, how that happens actually in the clinics and in the events, we'll have yet to see. But that's how we're trying to do it. And what we're really trying to do is see that the hospital is doing an additional amount for the elderly people, and that we're trying to do as many on the county side and with the larger events focused on employment.
Thank you, Adrian, for that additional question. Danila, you have one more question whenever you're ready.
Dr. Coren, with all the data that you're seeing, and I know that you're talking to other public health officers, do you believe Mendocino County has a chance of going into the red tier soon?
Good question. Soon is a relative term. Do I believe is also a relative term. I just took a look at the at our epi curve, and for this past week, I've been seeing 20, and then it went to 21, 22, and that sort of thing. This morning, it's down to 17.7. And when I look at the epidemiologic curve, it really is showing a very significant decline. So if we can keep up our masking and social distancing and hygiene and keep getting those vaccines into people and getting tested and mitigate any potential outbreaks, yeah, I think we'll get down there. I'm hopeful.
Thank you so much, Danila. And thank you, Dr. Coren, for that answer. I do see that we have Sarah Reith raising her hand. So Sarah, whenever you're ready to ask your third question.
I just want to follow up on the issue about people who are administering the vaccines for public health at the clinics. Have they yet gotten the word that they can accept other forms of proof that they are employed in an eligible tier?
Yeah, so what was required initially was a pay stub or something along those lines. It's evident that in the cash economy, many of the people we really want to vaccinate who are in those forms of employment don't get pay stubs, they get cash. And we still want to get them vaccinated. So we have said the preferred way is for the employers who are calling to get their employees in to write a list, and we'll have it at the door when people register and just say, who are you? Yes, you're in by virtue of your employment. I have a list. Or a note if there's not a large number of people, a note from their employer who says, this person works for me in such and such a capacity. That's all we really want to do. We want to validate this so it gets into the arms of the people who we know are at high risk, and we don't want to, I don't want to say waste it, but we want to target our interventions, and the whole state does as well. But it does become a little bit of a problem when you have people who are working in a cash economy And it's more of a problem actually as well when their employers may worry about the security of doing this. And some of the employers are concerned about the legality of their business or whatever. We don't really care. It's a very secure process. So if people bring in a note says, you know, this person picks grapes for me or picks marijuana for me, that's good for us.
Thank you so much, Sarah, for that question. I do not see any further third questions from the media on the call right now. So I will open it up to answer public questions. I'm looking at questions on social media. The first one I see here asks, we are at a point where some are vaccinated and others are not. Can you clarify what our behavior should be? Is it safe for not yet vaccinated people to visit our vaccinated elderly parents? What type of visits and behaviors are safe between vaccinated and non-vaccinated people?
Good question. So remember that we're very early in the course of even having some people vaccinated twice, and we don't have enough of a track record to know how well that protection is. You can look at research data and it changes. It's very hopeful in order to get it through the FDA, and then it changes when we are out in the community. So the advice we have is do all the same things that you were doing before. The only difference now is if you've had 2 vaccinations and 2 weeks for all that to take effect, then if you come in contact with someone who is ill with COVID, you do not have to be quarantined, but that only lasts for 3 months that we're pretty sure the immunity lasts, and more to come on that as we live through this vaccine and this pandemic.
Thank you, Dr. Coren. Our next question from the public is, how do we move to the next tier? I think that they mean, what can we personally do? What can we personally take responsibility for if we want to help our community move to the next tier?
Okay. So again, thank you for that, because we can't remind people too many times. Keep masking up. Wash or sanitize your hands often. Keep the social distancing. That 6 feet is very, very life-saving. Avoid gatherings and keep testing. So remember, again, testing is how we uncover the unknown, non-symptomatic patients that could pass it on to another 1 or 2 or 3 patients and create an outbreak. So testing is very important. Those are the things that we can do.
And for our third question from the public, Dr. Coren, what is your stance on double masking? Is it effective or is it even necessary?
So that's a great question. Double masking has come into the news more recently because many of the masks that initially were out there were very thin pieces of fabric, single layers. And the new advice is to be sure that they're double layers. And in that case, wearing 2 masks is probably a little more effective than wearing 1 mask, especially if it's a thin material. However, on the other side of the spectrum, for people who are using an N95 mask, there is no benefit and there may be some harm to double masking because it can dislodge the closeness of the mask to the face. So if it's outside, and it certainly will if the other mask is inside the N95. Some people will want to wear 2 surgical masks. It may give a little bit more protection. It's going to be harder to breathe through. So there's not really a great recommendation about that.
Okay, thank you so much, Dr. Coren. So we will try to give you 5 minutes before your next meeting as a break. Breaks are rare for you, we know that. So that does sum up today's COVID-19 update. Thank you so much to all for joining us. Our next update is scheduled for March 5th. Please continue to follow Mendocino County Public Health on Facebook for all COVID-19 updates. Thank you.
Thank you.